Toothworms and Spider Juice, read by Natalie Barton. Chapter 3, Tooth Pullers and Drillers. What happened when none of the magical cures or folk prescriptions stopped a toothache? The tooth was extracted. In many early civilizations, the sufferer took out his own tooth or had his neighbor do it. One of the more primitive methods of extracting a tooth was to place a chisel-shaped piece of wood against a tooth and pound it with a mallet. This method was chancy because often only the crown portion of the tooth broke off, leaving the infected roots still inside the gum. In ancient China, people called tooth pullers removed teeth with their fingers, which they strengthened for the task by spending hours pulling nails out of planks. Later on, pliers-like instruments made of iron called forceps were the most commonly used dental tool for extractions. When an abscessed tooth was taken out, sometimes the fumes of burning hashish, opium, and certain hemlocks were given for the pain, but their use was not widespread, and often nothing was done to numb the tooth. If more than one tooth needed to be extracted, the patient sometimes had to be chased down and held. Pulling teeth by inexperienced hands was also dangerous, many times resulting in broken jaws, the spread of infection, and even death. During the reign of Hammurabi, around 1792 through 1750 BC, the sixth and best-known ruler of the first dynasty of Babylonia, legitimate doctors began to treat medical and dental ills with surgery and medicines. Though these Babylonian physicians were rewarded generously, if successful, it was a risky profession. The following are two of 4 codes of laws that punished them if they injured their patients. Law 200. If someone knocks out the tooth of an equal, his own tooth is knocked out. Law 201. If someone knocks out the tooth of an inferior, he is fined 1/3 of a mina of silver. In Egypt, the practice of medicine was established more than 4,000 years ago. The Egyptian civilization recorded medical information of the time on papyrus and hieratic writings. The George Ebers Papyrus, 1550 BC, contains many references to dental ills, including gingivitis, erosion, pulpitis, and toothache. Though the Ebers Papyrus makes no mention of surgical procedures for these dental ills, the Edwin Smith Papyrus, 1600 BC, does tell of operations for fractured and dislocated mandibles, compound fractures of the maxilla, facial bone fractures, and lacerated lips. Both of these papyri contain material originating from as far back as the earliest dynasty in Egypt, about 3100 BC. The first known dentist was an Egyptian named Hissi-Ri. His title was Chief of the Toothers and Physicians. He lived about 3000 BC and specialized in dentistry. Wall carvings of forceps and knives show that Hissi-Ri and others like him primarily extracted teeth. They also appeared to have been skilled in drilling holes through the cortical plates of the jawbones. Many skulls were found with these holes. One of the oldest skulls, found dating from the Old Kingdom, 3100 to 2181 BC, had 2 holes of the exact same size and depth, apparently drilled in the jaw to relieve the pressure caused by the buildup of pus from a tooth with severe caries. In ancient Greece, a man named Hippocrates, about 460 to 377 BC, was considered the greatest physician of antiquity and is still referred to as the father of medicine. He claimed that disease was not the result of supernatural causes needing magical cures. It was, rather, a fault of nature, which could be corrected by physical and chemical agents. Besides writings related to the body, throughout Hippocrates' work are discussions of tooth formations and treatments. Dentistry and medicine were not separate professions in ancient times. Hippocrates explained the state of health and disease by naming 4 main fluids in the body, called the carnal humors: blood, phlegm, black bile, and yellow bile. He also stated that 4 elements affected the health as well: cold, heat, dryness, and moisture. All these humors and elements had to be in balance for a person to be healthy, according to Hippocrates. If anything, like too much phlegm, caused the humors and elements to be out of balance, then disease took place. It was from these teachings that the treatment of bloodletting became a common medical treatment to get the body in balance again. Hippocrates conducted all of his studies without examining a corpse or doing any kind of dissection. During ancient times, the human body was considered private and sacred. No autopsy or study of the inner anatomy was permitted. Because of these restrictions, Hippocrates didn't look inside people's mouths and count their teeth before proposing the mistaken theory that men had more teeth than women. Hippocrates also believed that tooth decay was caused by mucus and food attaching themselves to teeth with an inherited weakness. He recommended extractions of abscessed teeth only if they were loose, otherwise the operation was too dangerous for the patient. When it was necessary to pull a loose tooth, Hippocrates felt that the Greek forceps, called odontogra, were easy to use and could be handled by anyone. In ancient Rome, as in Greece, the Roman doctor made no distinction between diseases affecting the mouth and teeth and those of other parts of the body. What was unique about the Roman physicians was that women were allowed in the profession and were considered equal to their male colleagues. The Roman encyclopedist Celsus, about 25 BC to AD 50, described in detail the surgical instruments used by the physicians of his day, including forceps and an instrument called a tenaculum for extracting the roots of teeth. Besides doing extractions, early physicians sometimes filled decayed teeth. Roman doctors invented the technique of drilling into a decayed tooth and filling the cavity with a drug to ease the pain. One of these fillings was made of black veratrum, a plant with sedative qualities, mixed with honey. Unlike our strong fillings today, like silver amalgam or light-cured composites, those of early civilizations were soft materials and did little to strengthen the teeth. But often they stopped the pain by insulating and keeping out air from the open cavity. The one exception was more permanent fillings called silver paste, which the ancient Chinese developed in the 2nd century AD. It was similar to the silver amalgams developed by dentists in the West more than 1,000 years later. Here are a few examples of the strange and not so strange tooth-filling materials used by doctors of ancient times and the Middle Ages. Paprika, pepper, wax, the brain of a partridge, earwax, stone chips, turpentine resin, gum, metals, and ground bone. What were early dental drills like? The first drills were pieces of hard stones sharpened to a fine point and twisted into the tooth. Then came drills made of thin metal rods, turned by hand or rolled between the palms. Bow drills were one of mankind's first inventions and were used to make holes in many things before early dentists and surgeons found them useful. The bow drill looks like a small bow and arrow with a string tied across its opposite ends. Instead of an arrow, there is a drill made of a long, straight, thin metal rod. A handle, hollow like tube, is attached to one end of the drill. To operate the bow drill, one hand holds the handle as the other strokes the bow back and forth, like a violin, while the string winds, twists, and reverses, turning and pushing the drill into a tooth to make a fine hole. All these early drills had limitations because they were awkward to use on back teeth. It was also hard to see in the mouth without modern dental lights and mouth mirrors.